Welcome to the Q. My name is Nurse Bug. I'm your friendly neighborhood nurse surveyor.
Hey y'all, it's Amanda. Thanks for listening.
And hi, I'm Tina Webster. I'm so glad you joined us.
Today on our weekly podcast, we're going to be talking about what's ahead in 2024, trends like with staffing, regulatory compliance, quality care, safety, financials. The article started out with that 2023 was a year of census recovery, which after the pandemic, niche occupancy is increasing nationally, but it's still lower than pre-pandemic levels. And then it says, what defines the industry next year? 5 key issues likely are top of mind. And so we'll go through each one of these. I feel like we can discuss 1, 2, 3, 4, 5 points one at a time. So staffing was the first one. It says staffing continues to be exacerbated by COVID. We've seen spikes and outbreaks of that, and more competition for the existing labor pool, an aging nursing workforce, staffing mandates, turnover of DONs and admins. And then it said that there were opportunities to boost retention by prioritizing developing younger talent, investing in training programs, exploring partnerships, increasing wages, and reducing heavy workloads, which all are very, very good ideas in general to help with the staffing issues. Thoughts, ladies?
I think one of the saddest things that has come out as far as staffing goes from COVID is the turnover of your directors of nursing and your admins. I think that's one of the hardest things to recover from. It really destabilizes the facilities because once you have one of those key positions turned over, you have someone else that comes in and they have all new ideas or all new goals associated with how you're going to achieve your outcomes. And that is very disruptive to staff, and it contributes to staffing burnout. Now, some of the turnover is probably necessary, not debating that, but for the majority of it, probably not. Trying to keep onto those key positions is really crucial. And then you add staffing mandates into the mix of it, and it's really got our industry up in tailspin, really, because we don't know if we're going to have enough RN coverage to support the new staffing mandates. And that's very concerning, especially for your rural nursing homes.
I don't know if you guys have heard this too, but like they're accelerating nursing programs, which is all fine and good, but then you have a brand new baby nurse right out of nursing school that may not have, you know what I mean? I don't want to say that these accelerated programs are bad, not at all, but you have a brand new baby nurse that may not have all those components that, you know, a nurse that got 4 years. So you have kind of a learning curve, and experience is the best teacher, of course. That's one thing that I thought about.
As a DON, it was like I had these brand new baby nurses, which we love. It was always my idea to change that whole scenario. You've always heard that nurses eat their young. It's been so true. I can't tell you as a brand new nurse how many times I got chewed up and spit back out, but we were supposed to be like that. You know, that's how you earn your badge of honor. And I was like, no. I do not want to tear someone apart to build them back up. I want them to feel comfortable. So I was all about educating, and just cuddling those little babies. But when the pandemic happened and you still had these nurses in nursing school during that pandemic, they were done such a disservice because a lot of those clinical rotations were canceled for them. They didn't get to have that one-on-one interaction. So they were taught from a computer screen, right? They lacked even more experience than those prior to them. You add on top of that your accelerated programs, we really are doing our industry a disservice because we're trying to baptize them by fire.
You know, it wasn't just the nurses, it was the CNAs that were affected as well.
Yeah.
Because those CNA classes, they got cut down to get the CNAs through an accelerated program so that they could get into the workforce. The nursing industry itself, with both of those positions, they had a huge disservice really to them as it goes to the kind of experience and knowledge and support that they would have gotten if they had been able to go through those further programs.
See, that's crazy to me because classes were what, 4 weeks to begin with, 4 to 6 weeks. And now what are they now?
It was almost in half.
Yeah.
I know that. But it was a crucial time in the world.
Well,
I mean, it was a crucial time and they had to do what they had to do to get people into the industry to help take care of these, all of the patients that did in fact really affect our staffing.
I had worked with the facility actually this year. I love them so much. I'm going to shout them out. So for their staffing retention, they are at present and holding for the last 2 months. Not to jinx them, knocking on wood, everything else, penny on heads. They have 0 nursing position open right now. They are a facility in Middle Tennessee. Woo woo! Shout out to Tennessee.
Mm-hmm.
What they have done is they have done something in lieu of benefits. We're talking about staffing pay and trying to knock down the trend of traveling. So in lieu of benefits, they have a 15% increase on their hourly wages, right? They have a Baylor program, so they have an increase if you're on the weekends as far as the amount that you get paid, and then night shift just as well. So those nurses and those CNAs, if they don't have to have those benefits, they are making the same amount of pay as what they would traveling. It's the same structure. When you travel, you're not getting those benefits. They have found that way to keep their staff in-house instead of having to use agency. If you don't mind, I'd love to share something before going to the next topic, Lindsay. It was actually out of McKnight's this morning. It was talking about contract CNA staffing associated with worse care quality outcomes. This study was conducted in 2023. They found that CNAs in SNFs increased for hours to be filled, increased from 2% in 2017 to almost 11% in 2022, which is significant. Even though they have higher hourly wages and greater flexibilities for the employers and workers, there are practice concerns about rising labor costs and also lack of benefits. But as far as quality goes, they have poor quality outcomes related to inconsistency of staff. So meaning you've seen an increase in falls, you see an increase of infections, you see an increase of behaviors. And why is this? Because we don't have the continuity of care. Somebody brand spanking news coming into your dementia resident's room to take care of them, and they don't know me, or they don't know them personally, don't recognize them, and you're not talking to me about what you're doing, you're just doing it. What do you think that's going to do?
We all know that consistent staffing assignments benefit our residents. I mean, that's just a gift. That's an awesome story. I like that. I like that one. Very good. Okay, so we'll move on to regulatory and compliance. The current administration and CMS are holding facilities more accountable, of course, by pushing harder to ensure safety and well-being through the staffing mandate, infection control practices, emphasis on survey process, application of more equitable CMPs, and reduced antipsychotic use. And so, of course, that's going to include ongoing training and resources that helps the facilities stay compliant with complex and challenging regs. That right there has been a big topic this year and the end of last year. I feel like as we work out these kinks, it's going to get better, but in relation to staffing, the mandate has made things a bit challenging. Ladies, thoughts?
Well, we've seen a big push for regulatory compliance, I feel like, across the nation. When you look on when this came out around midsummer in 2023, right? That's when we really saw the Biden administration take effect with this. And since then, how many nursing facilities have we seen closed, cited for closure? But not only that, the increase in the civil monetary penalties associated with not being in compliance. That's significant, I feel.
The increase in CMP deficiencies, but the decrease in CMP initiative projects. Like, it's so sad. So
It is. Take into consideration, the CMP project funds, the whole system was revamped. So facilities are now only allowed, the $5,000 per project to be granted for that. That's a significant cut for facilities, I feel like. I hope more facilities go after to produce these CMP projects because it's such a benefit for them to work on falls, to work on antipsychotic reduction, infection control. There's very creative ways to do that, and it's needed. Also, on the same end, if I was that DON and it was just $5,000 for me to be able to do a project, that's really eating at that money for me right off the bat. It's very hard to be like, I'm going to go after that. But the $5,000 that I'm allocated is used immediately, almost.
It's a darn shame is what it is, especially for the facilities that have benefited from things such as our CSC project. I came into this in end of year 3, beginning of year 4-ish. Every area we're going to talk about, our project, it addresses every area. So to me, the fact that these are going to be harder to acquire and don't meet the standards of, the financials that we had before our CMP projects, it's only going to hurt nursing homes by not having these and the things that we can make available to them through the CMP projects. Tina, did you have anything on regulatory and compliance?
No, I totally agree with you guys. It's a shame that the facilities, they have benefited from having this free education. So just hopefully going forward in the year to come, hopefully the CMS will possibly look at that and be more creative with the facilities on allowing them some free education.
Agree. And not only that, I think for us, all of the facilities that we work with, I think we all can agree that even though it's changed as far as the structure for the CMP programs, that we're here to support them and encourage them to still go after those monies to help benefit them. There has to be a way to be able to do that so they can still have those quality initiatives.
Okay. So the next bullet point was quality care and resident safety. A continued focus on top issues impacting resident health and well-being, which they cited infections, med errors, falls, adverse events in general. And that facilities who invest in QI initiatives like tech adoption to prevent costly errors and rehospitalizations will also attract residents, new admits, and garner tax dollar support, which is all true. All very much true. We've been talking about the CSC project, quality care, resident safety. It's like literally the ball that moves into all the little tendrils that we work with them on.
I think all of us in this industry get into this industry because we want quality of care and resident safety, right? It takes strong, very like-minded individuals to represent our long-term care population and especially love them with the ever-changing comorbidities and complications related to behavioral management, because some days it can be very frustrating and it can be very challenging, but we accomplish those days because we love them and we come back the next day because we love them and we want the best for them. I think everybody's focus is quality. I truly do. I think sometimes we lose sight of quality of care because they're in a DON's day, how many things come up in our day that throw us off guard, or administrators. But I always feel like number one, quality of care and resident safety is what we strive for.
That it gets you those 5-star ratings, those QMs.
Well, and looking at rehospitalization, that's a big focus, and making sure that we are giving that quality care. We're keeping our residents in-house, treating them in-house, as opposed to sending them back out to the hospital, in that 30-day window. It's definitely something that I think everyone that's in the nursing home environment, that is something that they strive to do, is to try to keep their residents safe and treated within house to avoid any kind of penalties or affecting their relationship with the hospital discharge planners. They want to be that that preferred provider with the hospital.
And I think as our long-term care industry adapts, Tina, and I know you've seen this too over the years, because it really in the last 10 years, we've seen this as we're moving from the nursing home to the post-acute care world. Our residents come in sicker and sicker, and they're still going through these acute on chronic processes. And that's where we come in as far as, quality of care and really trying to adapt to that education and give that support that our nurses need so that we can stop these costly medication errors, these costly readmissions, reduce those adverse events, falls and infections. I really feel like we try, and we're trying. And I think our industry is moving towards more education is a positive outcome that flows with quality of care, regulatory compliance, and investing in our staff.
With 50 years of experience and experts across all areas of nursing home care, Qsource genuinely understands the needs of your facility. We've always been there alongside you, and we've walked in your shoes. No matter the situation, Qsource is prepared to tackle your challenges, solve your issues, and answer your questions. Let Qsource encourage, educate, and empower you. Contact us at any time at qsource.org. We will always be here to help. And now back to the podcast.
That actually leads into their next bullet point. It was financial strain, and they talked about how residents nowadays have higher care needs, Medicaid and Medicare reimbursement, there are issues, rising operational costs and general inflationary pressures, limited savings, the need for upgrades and renovations to their older buildings, which means shrinkage for operators in margins and potential market size. What they need to do to kind of help with that is they can open up other specialty services, forge strategic partnerships, and then use data to identify cost savings opportunities. We talk about like MDS and reimbursement and stuff like that, but those are all other areas that people don't think about. I've heard that activity directors have to buy their own crafts sometimes, or they buy prizes for bingo and that sort of stuff. And that's from their pay. They're not getting this from the facility. Sometimes they use their own. I think that's beautiful and wonderful, but should they have to do that? You know what I mean?
No.
No, they shouldn't. They shouldn't.
No.
Yeah, when they're supposed to do that.
The reimbursement to the facilities has lessened. They're not getting the reimbursement that they used to get. And unfortunately, the audits have increased. So when they come in and do an audit and there's not supporting documentation for a skilled service, then that money is recouped by CMS. So it is a financial strain. Most facilities really do. They struggle with balancing all of those things that you need to have in the nursing home facility that costs money.
They do. I think that's too, like we mentioned MDS again, I think that's why it's so important. A lot of times we're just interested, and this is our industry's problem. We're just interested in filling the position because we're so far behind in something, right? Instead of maybe taking that individual that we do have prospect and educating them on what they need to do, setting them up for success like MDS coordinators, then you really start to fill that gap as far as reimbursement issues, right? Trying to get the best assessment coded so that you're really getting the reimbursement that you need to take care of that resident, right? Like Medicaid and Medicare have given us these rules and regulations. You find them in the REI manual. Everybody knows that's been around for a long time. Every October, we have an update. October's it for MDSs, and paying attention to that. We're in the middle of one right now with value-based purchasing, and we're getting ready to start seeing our QMs freeze, and we're starting to prepare for that. So really starting right now to set your facility up for success. And being a part of that success, your MDS coordinator, and getting them the resources and the educations and the certifications they need is really setting you up for financial improvements in the incoming years. It goes back to education.
Yeah, absolutely. Always.
When it comes to moving forward, okay, I love that forward-thinking thought. And their last bullet point was about tech adoption. And I know that EMRs can be costly, okay, but it helps them operate more efficiently, communicate more effectively with partners and staff, provide better resident care. We've talked about telehealth, electronic communication platforms, and then, of course, the analytics that come from that to identify ways to improve their workflows. But tech adoption, the ones that use paper charts, you have misadministrations. You have things that go the wayside because they're on paper. There's nothing to alert you that something has been missed. You have to have something in place and move forward to be able to continue to succeed in this sector. You just have to.
You know, I think one of the greatest things that I have seen over the years when it comes to tech adoption was when the dashboards became available in the electronic system for the directors of nursing and for their, the supervisors, so that it brought things forward to let the DON know, hey, these medications weren't administered today. Those kind of things. To me, as a DON, it was imperative that was available. I mean, it was just made things so much better. In essence, it affected the quality of care that the residents received, because you could make sure that they got their medicines, that they didn't have medication errors. There was just so many things that using that electronic system has just been wonderful. It's just been wonderful.
I would say that long-term care in general has been so slow to adapt new technology. And why we are like that, I do not understand. I'm all about it. Like taking my analytics and putting them on a graph. I am doing an improvement project with falls. I want to see it. I want to see it displayed. I want my staff to see it displayed. I want them to know, hey, as a whole, we're improving. But hey, look at Section A. Look at Hall 1. What's going on here, guys? Where do we need to dig down? And we do this together. And when you can show your staff, they get so excited, right?
Yeah.
That's just one thing. That's just analytics. That's just a graph, right?
Mm-hmm.
Electronic charting, it decreases their workload. Electronic charting for nurses decreases our workload. Of course, yes, it brings in a whole nother consideration. Are you capturing what you need? But there again, we go back to education. And then as we see new technology adapt to wearables, if something's going to tell me that something is off with my resident before I can clinically see that and I can prevent a hospitalization or fall, I'm all about it. Please, where do I sign up for this? Where do I do this? I mean, it gets me so excited. Like I start nerding out when it comes to AI.
I do agree that in the past, in the long-term care industry, we've been a little slower to adopt things. But I do believe that we are seeing so much more being adopted now, and people forward-thinking. I definitely see great things when it comes to the technology that is in long-term care today. It only improving.
I agree. And I can't wait from 10 years from now to see where this conversation comes and the technologies that we have adapted. Even if you think about AI as far as educational pieces, that is what one of the things that I hope for Qsource we're able to accomplish is really how you can take AI and technology and increase your nurses' education, CNA's education, anybody that has a part of the nursing home, and see what we can do with that. I'm very excited about the future as far as this goes.
Basically, to sum it all up, we've talked about 5 different areas. I kind of combined a few of them because I feel like into 3 areas that Qsource can help with. Okay, so staffing and quality of care. We build up best practice, okay, for not only for staff, but management who need, the education to hit the floor and provide the safest, highest quality care for all residents, all while being CMS compliant. So
me and sister.
Yeah, if you need assistance with recruitment, retention, We have tools for all of that. We've completed CSC projects that we talked about earlier for various PIPs, including staffing, pressure ulcers, falls, psychotropics, antipsychotics. I mean, the list goes on. It really does. There was an opioid project years ago. We've done a lot of that. Moving into financial strain, Qsource can help with mock surveys to prevent deficiencies. And then MDF scrubs to ensure that every area that's connected with your financial reimbursement has been reviewed to get the highest possible reimbursement and provide training to your MDS coordinator if they're new, if they need it. We have RAC certified QI advisors that can assist with all of this. And we want to help. And then the last, bullet point, of course, was the tech adoption. We want to bring you into the new age of EMRs. Also, do residents need companions or individualized activities? We can help. New interventions for physical therapy residents or fall prevention for repeat fallers, we can assist with that. There's so many new tech ideas out there, and we want to help you find them. We got to kind of wade through to find the individualized ones that your residents need. And we want to help.
I think a great way to sum it up is Qsource is here to help you with whatever. The world is your oyster. It's what you do with it.
And everything. Unlimited. It's like Pandora's box. You open it and we got them.
Okay. But in positive light. So nothing negative. Nothing negative. Yeah. All positive.
Well, sometimes you don't realize when you're at the facility level because things are moving so fast and things are coming at you when you're in leadership. Things are coming at you pretty quickly. You don't always have the time to invest in your staff, invest in their education, invest in giving them tools to help them with their jobs. And so that's where I find that Qsource is so beneficial, is because we can do that. We can come into the facilities, we can work with the staff, we could be that investment for the company to grow their staff. Anyway, I'm passionate about it too. It gets me excited when we talk about mentoring and education and opening our doors and inviting people to let us come in to their house.
Yeah, you have a box survey and you need us to come in for a plan of correction. We can be there in less than 24 hours, okay? Right there with you, holding your hand to figure it all out because it can be stressful, super stressful.
Okay, Lindsay, you always do a wonderful quote at the end of this, but I would like to take that over for today. Yeah. You don't mind? Yeah. All right. Okay. Here we go. Yesterday is not ours to recover, but tomorrow's is ours to win or lose. Don't look back. You're not going that way.
Woo, woo, yeah. Woo, woo.
There you go.
That's exactly
looking forward.
Was that Mother Teresa or?
Oh, no, that was the Google machine.
Even better. No, I like it. Well, okay, to end on that note, our teaser for next week, and this is a fun one, guys. I cannot wait to do this one. I had so much fun putting it together, but next week we're going to be talking about utilization of pets in nursing homes. I'm not going to give anything crazy away, but it's so much fun.
Near and dear to my heart. This is near and dear to my heart as a DON, near and dear.
Yeah. Just think of when you see the residents that have babies, and they're loving on them and whatnot. It's going to be in that area, but I love it. So thanks for joining the Q's weekly podcast, of course, for all of your nursing home needs and topics. And until next time, have a great week, everyone.
Yeah. Bye, guys. Bye. Thank you.
Thank you for listening to this Qsource podcast. If you ever find yourself needing Qsource to assist your facility, please reach out to us at qsource.org so our long-term care experts can help you through the process. If you want to hear more podcasts like this, you can find us on Apple Podcasts, Google Podcasts, Spotify, and wherever you listen to your favorite audio. Just search for Qsource and you will find us. Thank you and have an amazing day.